Good morning, dear students. We are going to discuss portal vein and portocaval anastomosis today. So we know like portal vein is the large vein which collects blood from abdominal part of the gastrointestinal tract, that is alimentary tract. It also collects blood from the gallbladder, pancreas, the spleen and conveys it to the liver. So in the liver, the portal vein breaks up into sinusoids which are drained by hepatic veins to the inferior vena cava. Where exactly this portal vein is present and how is it formed? Now let us see. See, this is the C fold of duodenum. So this is the first part of duodenum, second part of duodenum, third and fourth part of the duodenum. So within the C fold of duodenum, we have pancreas. The part of pancreas we have are head, neck, body and tail. So with at the neck of the pancreas, we are seeing like superior mesenteric vein and the splenic vein. Both of them are joining to form hepatic portal vein. Okay. So how is this portal system different from the other parts of circulation? Now you can see the usual circulation. At one side we will see the arteries dividing into arterioles, meta-arterioles and capillaries. Capillaries will be joining to form the venules, and finally the venules will join to form veins, and there are big veins draining into superior and inferior vena cavae, right? So here you have one network of capillaries, right? So similarly, in the liver, we have two sets of capillaries. One set of capillaries we find in the gastrointestinal tract, that is stomach and the intestines, and other set of capillaries we will find in the liver. So connecting these two set of capillaries, there is a port in the sense there is a like something like bridge which is connecting this network of like capillaries and this network of capillaries. So this connecting channel of two sets of capillaries is nothing but hepatic portal vein. So the hepatic portal vein, now you can see here, it is collecting the venous blood. See what are the various parts of the GIT we are finding here? Esophagus, stomach, small intestine, that is duodenum, jejunum and ileum. Ileum is opening into the cecum, okay, and this is appendix, then and this is ascending colon, transverse colon, descending colon, sigmoid colon, rectum continuing as anal canal. So if you observe this picture, we are finding the venous network. So you can see this hepatic portal vein origin and end in capillaries and venous sinusoids. The size of this hepatic portal vein is 8 centimeters in length and 1 centimeter in width, and it drains the abdominal part of the alimentary tract except lower part of the anal canal. So it is draining spleen, pancreas, conveys absorbed products of the digested food to liver, and it is devoid of valves. That means it has no valves, and it is reservoir of blood, that is around 1200 ml per minute. You will see the blood is moving. Now the formation, so the union of this superior mesenteric vein and the splenic vein between is leading to the formation of portal vein. So it is seen at the neck of the pancreas and inferior vena cava at the level of second lumbar vertebra. Then the course, you can see here, it is passing upwards and right. This is upwards and towards the right side behind the neck of the pancreas and the first part of the duodenum, enters into the right free margin of lesser omentum in front of the epiploic foramen with bile duct and hepatic artery, reaches porta hepatis and divides into right and left branches, right branch of portal vein and left branch of portal vein. So from this picture from yesterday's lecture, you must have clearly understood the peritoneum. We can see this is stomach and this is lesser curvature, where we have the attachment of lesser omentum, greater curvature, we have the attachment of greater omentum. So this is the right free margin of lesser omentum where finger has been passed to check, like this is the place where we have the epiploic foramen, also called as foramen of Winslow. Okay, so this is the passage or the hole which is actually helping as a connecting agent or connection network between the greater and lesser sacs. So greater sac is present right in front of the stomach and the greater and lesser omenta, and lesser sac is found behind the stomach. So the connecting channel between greater and lesser sacs is nothing but epiploic foramen. And when you just pass this finger and when we try to cut open this area, we will see exactly like this. So this is our pyloric part of the stomach, pyloric part of the stomach and first part of the duodenum, where you can see this yellow in color, you will see is the, blue in color is nothing but the portal vein. Okay, so once we have cut this right free margin of the great, like lesser omentum, right free margin of the lesser omentum, when we just cut open, we will see VAD structures. V, A, D. V is standing for portal vein, A is standing for hepatic artery, and D is standing for bile duct. Okay, these are the same structures what we see at the porta hepatis of the liver as well. Okay, so this is the picture what you should keep in mind in order to. Hence now you will clearly understand like the portal vein is entering into the right free margin of the lesser omentum in front of the epiploic foramen with bile duct and hepatic artery, nothing but VAD structures. V portal vein, A hepatic artery and D bile duct. So it is reaching porta hepatis of the liver where it is dividing into right portal vein and left portal vein. These are the branches. Now, so now see here the branches of portal vein. So you can see, if you remember the histology, we have hexagonal hepatic lobules. So in this hexagonal hepatic lobules, what we are finding is, so now the course is in the intrahepatic part, like within the liver, you will see this is the central vein and this is the hexagonal hepatic lobule. So at each margin, we will see VAD structures, right? So you can see at each corner of this hexagonal hepatic lobule, we are finding the tributary of portal vein, branch of hepatic artery, and small ductules which are draining into the bile duct. So we will see the branches of portal vein, segmental branches and branches in portal canal. So hepatic sinusoids, central vein, sublobular vein, hepatic vein. Finally, you will see the whole venous blood will be draining into the inferior vena cava. Okay, so what we are able to see, this is the portal vein and the segmental branches we will see here. And between the hepatocytes in this hexagonal hepatic lobule, this little whitish area is the place for hepatic sinusoids. So from here, the blood is draining into central vein. From here, it will be draining into sublobular veins, hepatic veins, and inferior vena cava. So now this is the line diagram of a whole of the portal vein which you can draw for your exam. But take care, like you use violet colored pencil in order to draw the portal vein. Okay, now we know like the portal vein is formed by the union of superior mesenteric vein and splenic vein. So this is our hepatic portal vein. So into the portal vein, you will see superior pancreatico-duodenal vein is opening, right gastric vein, left gastric vein. Okay, they drain into the portal vein, and this is right branch of portal vein which is going into right lobe of the liver. So left branch of portal vein which will be draining into the left lobe of the liver, and these two branches we will see at the level of porta hepatis. So into the right branch we are finding cystic vein is draining, and into the left branch we are finding para-umbilical veins are draining. Okay. Now, the various tributaries, like we have formative tributaries, like the main thing which is leading to the formation of portal vein, that is superior mesenteric vein and splenic vein. So received by the trunk. So this is the trunk of portal vein. Into this you will see this is the right and left gastric veins, and the like we also find into this trunk, we are also finding the superior pancreatico-duodenal vein is also opening. Okay, like superior pancreatico-duodenal vein. So this is into the trunk. So this is right branch and left branch. So received by branches, we have cystic vein. We also have around the umbilicus, the para-umbilical veins. Occasionally, we will see the inferior mesenteric vein, right gastroepiploic and pre-pyloric vein also open into the portal vein. So of course, we have many variations. Okay. Then, so now coming to the branches. So when you talk about the right branch of the portal vein, so it is shorter, wider, and it is receiving cystic vein as we have seen in our previous picture. Left branch is narrower, longer, and it runs in the porta hepatis from right to left. Okay, so branches to caudate and quadrate lobe are also given, and it receives para-umbilical veins, the left branch. So now see here, this C-shaped area, what you see is duodenum. So within this C-fold of duodenum, we will see the pancreas, and in the neck of the pancreas, we will see the formation of portal vein. So here you will see, so like whole of the portal vein is related to the first part of the duodenum. The part of portal vein which is below the first part of duodenum, you call it as infraduodenal part. Behind the first part of the duodenum, we call retroduodenal part, and above the first part of the duodenum, it is supraduodenal part. You can see 1, 2, 3 numbers have been given. Below the first part of duodenum is infraduodenal. Behind the first part of duodenum, number 2, retroduodenal. And above the first part of the duodenum, we call it as supraduodenal, like continuation, like course of this portal vein. Now let us see the relations below the first part of the duodenum, that is infraduodenal part. So anteriorly it is related to neck of the pancreas, and posteriorly it is related to inferior vena cava. Retroduodenal, retro in the sense it is behind the first part of the duodenum. Okay. Now anteriorly retroduodenal part is related to first part of duodenum, bile duct and the gastroduodenal artery. Posteriorly, even this part is also related to inferior vena cava. Above first part of duodenum is the supraduodenal part, which is seen in the right free margin of the lesser omentum, where we have this epiploic foramen. So anteriorly, it is related to hepatic artery and bile duct, and posteriorly, it is related to inferior vena cava. So it is surrounded by hepatic plexus of nerves, lymphatics, and lymph nodes. So this you can see, like this is duodenum, what we have. The first part of the duodenum and a part of second part of the duodenum has been cut to make the vision clear. Okay, this whole thing is portal vein, which is formed at the neck of the pancreas. So this is our splenic vein, this is superior mesenteric vein. Both of them are joining to form the portal vein. At the porta hepatis, we know it is dividing into right branch and left branch. Right branch is comparatively smaller and left branch is narrower and longer. Okay. Now, so the portal vein is about 8 centimeters long. It is formed by the union of superior mesenteric and splenic veins behind the neck of the pancreas. Okay, at the level of second lumbar vertebra. So inferior mesenteric vein drains into splenic vein. So it runs upwards and a little to the right, first behind the neck of the pancreas, Next, behind the first part of the duodenum, and lastly in the right free margin of lesser omentum. The termination we know, like the vein ends at the right end of porta hepatis by dividing into right and left branches. The course has been divided into infraduodenal, retroduodenal, supraduodenal, and the one which is entering into the porta hepatis and dividing into right and left branch, that particular part has been named as intrahepatic course. Okay, so the branches are right branch and left branch. So the summary of tributaries, we have seen it is receiving left gastric vein, right gastric vein. See, this is right gastric vein is this, left gastric vein is this. Then superior pancreatico-duodenal vein, you can see here, this is superior pancreatico-duodenal vein. Then cystic vein, so this is the right branch which is receiving cystic vein, and left branch which is receiving paraumbilical veins. Okay, so better practice this diagram using this color. Okay, so because this is very, very important. This is one more picture which is taken from Gray's Anatomy, which clearly shows like the portal vein is seen at the right free margin of the lesser omentum, that is at the level of epiploic foramen. You can see this is the stomach and this area is left gastric vein, okay, which is draining into the main trunk. Similarly, we have right gastric vein which is cut here, okay, and we have pancreatico-duodenal veins, okay. We can see this is duodenum and this is the pancreas, this is the neck of the pancreas which has been cut open. Hence this is splenic vein, this is like superior mesenteric vein. Into the splenic vein we are finding inferior mesenteric vein is opening. So inferior mesenteric vein is collecting the venous blood from the left half of the transverse colon, descending colon, isn't it? Sigmoid colon, rectum, anal canal, which are actually the derivatives of hindgut in embryology, what you have studied, right? Then, so this is the superior mesenteric vein, which is collecting the venous blood from the small intestine, that is below the opening of the common bile duct, that is in the second part of the duodenum. That means the whole of the derivatives of midgut, that means lower half of the second part of the duodenum, third and fourth part of the duodenum, jejunum, ileum, cecum, appendix, ascending colon, and right 2/3 of the transverse colon. From here, the whole venous blood is draining into the superior mesenteric vein, and inferior mesenteric vein is draining into the splenic vein. The superior mesenteric vein and the splenic vein are joining to form hepatic portal vein. So we know like it is beginning as set of capillaries and also beginning in as set of capillaries in the GIT, ending in set of capillaries in the liver. So formed anterior to the inferior vena cava, posterior to the neck of the pancreas at the level of second lumbar vertebra. It is large vessel but runs a short distance, only 7 to 8 centimeters in the lesser omentum, where it is posterior to hepatic artery and bile duct. I mean that is these are the VAD structures, vein, portal vein, hepatic artery and bile duct. Okay. So it contains blood which is reduced in oxygen but rich in nutrients from the abdominal part of the gastrointestinal tract. At the porta hepatis, it divides into right and left branches. So streaming of blood, as it is formed by the union of splenic vein and superior mesenteric vein, there are two streams of blood, and it is thought that the blood from the splenic vein goes to left lobe of the liver. The blood from superior mesenteric vein passes into the right lobe. Portal vein and its tributaries have no valves, please remember. So because of the general direction of the portal vein from left to right, amoebic abscesses are common in the right lobe. Since the liver is directly in contact with the diaphragm at the bare area, these abscesses, amoebic abscesses, can break into pleural cavity. That means the infection can easily spread from the liver to the lung as well. Okay. Behind the first part of the duodenum, it is related to gastroduodenal artery and bile duct. Above the duodenum, it enters the right free margin of lesser omentum where it lies anterior to the epiploic foramen, isn't it? So the where the finger is passed, that is the epiploic foramen, and this is the point where we have the portal vein. So we can see this is the portal vein. Okay, anteriorly it is related to hepatic artery and also the bile duct. Okay, so in this picture also, radiographic picture, we are finding the outline of the portal vein. So its branches end in segmental pattern in the liver and end in sinusoids, which I have shown in my previous slide. The left branch is connected to the inferior vena cava by a vessel called as ductus venosus in fetal life to bypass the blood coming from left umbilical vein, because lungs are not yet functional and the fetus is receiving ready-made oxygenated blood from placenta. Hence, you are finding the left branch of portal vein is connected to inferior vena cava directly by means of ductus venosus. Okay. So the remnant will be ligamentum venosum, what we see with the liver. So the duct is obliterated after birth, that is postnatally, to form ligamentum venosum. Okay, now you can see this is one more picture which is helping us to understand more clearly the hexagonal hepatic lobule. Only one side is shown. So you can see at each corner we have portal triad, isn't it? Where we have one tributary of portal vein, branch of hepatic artery and biliary canaliculi. Now, the blood from this portal vein, you can see it is moving through this sinusoids, which are present between the hepatocytes. The sinusoids are shown in pink color. So you can see the venous blood from the portal vein via sinusoids, it is reaching the central vein. Okay, that is. So since it supplies about 70% of blood to the liver, progressive occlusion to the hepatic artery rarely results in complete necrosis of the liver. Okay, that means it's a very good gift what we are having, because suppose even the hepatic artery is blocked, still liver is not suffering with any necrosis. Okay, still it is receiving the blood supply, oxygenated blood about 70%. Okay, so that's the reason even progressive occlusion of hepatic artery, it usually doesn't result in complete necrosis of the liver. Okay. There are certain areas where you will see the portal vein has communications with inferior vena cava. So those sites are called portocaval anastomoses. Okay, let us see. So whatever has been shown in violet color here, these are the tributaries of portal vein, and whatever has been shown in blue color, that skylight blue color, that is inferior vena cava. So this inferior vena cava has certain communications with the portal vein. So together we call it as portocaval anastomosis. So such portocaval anastomosis we are finding, see different numbers like A, B, C, D is given. A is, we are finding anastomotic network at the esophagus, where we are finding the left gastric vein, which is the tributary of portal vein, is having anastomotic network with the esophageal vein, which is actually draining into azygous system of vein. So this is portocaval anastomosis. Okay, one at the esophagus. Now, another anastomotic network B, A, B, right? So we are finding at the rectum and anal canal. So at this point also, we can see here, superior rectal vein is shown in violet color, which is one of the tributary of portal vein. So it is forming anastomotic network with the middle and inferior rectal veins, which are actually tributaries draining into inferior vena cava. Okay, so here also at rectum anal canal also we have portocaval anastomosis. Now C is shown here, which is umbilicus. So around the umbilicus also we are finding paraumbilical vein, which is actually a tributary draining into the left lobe of the liver. So it is having anastomotic network with the epigastric veins. These epigastric veins are actually draining into the inferior vena cava. Okay, so Paraumbilical veins and the epigastric veins, and the network of veins we are finding at the umbilicus. See, okay. So we have also retroperitoneal veins behind the peritoneum. So where we will see certain colic veins are actually anastomosing with the retroperitoneal veins. Retroperitoneal veins are the veins draining into inferior vena cava, and colic veins are the veins which are draining into portal vein. So like that, we have different areas where the portal vein is having connections, are the anastomotic network with the inferior vena cava. Now let us see in the form of a table. At the lower end of the esophagus, the portal vein tributary is left gastric vein. Systemic, that means inferior vena caval tributary is esophageal veins which are draining into azygous system of veins. Lower end of anal canal B, I have shown you. There you can see superior rectal vein is draining. Middle and inferior rectal vein, these are the tributaries of inferior vena cava. So they have an anastomotic network at the lower end of anal canal. Around the umbilicus, the tributary of portal vein, paraumbilical vein, and tributary of inferior vena cava, superior and inferior epigastric veins. They form a network. At the bare area of liver, the tributary of portal vein are the portal vein radicals, and systemic veins are diaphragmatic veins to azygous system of veins. So hepatic and splenic flexure region, portal vein tributaries are omental and colonic veins, and systemic veins are retroperitoneal veins. So all these are the areas where we have anastomotic network, which is very, very important. That is portocaval anastomosis. As such, portal vein is an essay question, and portocaval anastomosis is a part of essay question. If not, portocaval anastomosis itself can come as a short note as well. Photosystemic communications, the same thing what I have discussed in my previous slides is given something like this in your Chaurasia textbook, which you can follow. It's quite easy. Try to practice the diagram which is given here. So this is portal vein, which is shown in violet color, and inferior vena cava, which has been shown in blue color. Different numbers are given. This is at the level of the esophagus. We have an anastomosis, abdominal part of esophagus. Check what are the tributaries of portal vein and the systemic vein. Suppose if there is any portal hypertension. So what is portal hypertension? That means when in case of liver failure, you will see there may be like increased blood pressure and the blood vessels may rupture. So in such condition, in case of liver cirrhosis, these tributaries generally rupture and it will lead to blood vomiting. So which condition is actually called as esophageal varices. These varices may rupture and may cause hematemesis. So most of you should have seen this movie, right? Devdas. So how did he die? In that movie, you should have seen he has vomited blood, right? So that is nothing but you will see there is portal hypertension, which usually occurs due to intake of excess alcohol, where the liver gets damaged and the blood pressure rises, and it may lead to portal hypertension. So now usually you will have clinical way of framing the question. So some points about portal hypertension, you will see the pressure is rising above greater than 12 mm of mercury, and the causes are prehepatic, that is it may be thrombosis of portal vein, that means you will see within the portal vein the blood may get clotted. Hepatic, like liver may get damaged due to a failure like fibrosis of liver, which is called as cirrhosis. So post-hepatic causes, there can be Budd-Chiari syndrome. So effects are like patient presents with splenomegaly, collection of fluid in the peritoneal cavity, which is called as ascites. There may be collateral circulation through sites of portosystemic anastomosis. So suppose if there is like a rupture of the portocaval anastomosis at anal canal, patient presents with internal piles or hemorrhoids, external hemorrhoids. That means you will see the fecal matter is containing blood. Okay. Then, so caput medusae is a condition where you will see The paraumbilical veins, we have seen there is a network of anastomoses around the umbilicus. So suppose in case of hypertension, you will see these veins also get enlarged and they look like worms, earthworms. Hence, this has been named as caput medusae or something like snake. Now, so this is esophagus, and we know at the esophagus also we have portocaval anastomosis. So in case of portal hypertension, you will see this veins may get ruptured, okay, and there may be a condition which is called as esophageal varices, where patient presents with blood vomiting, okay. So that's what we have seen in Devdas, like because of excessive intake of alcohol, all such clinical conditions occur. So for your convenience, you can use this picture like this slide where you have full summary where we have the portocaval anastomosis. So what are the tributaries? Suppose around the umbilicus, we usually see clinical condition in cirrhosis where paraumbilical veins open up to transfer portal venous blood into systemic circulation. It results in caput medusae, which I have shown you just now. Anal canal also, we have the anastomotic network, portocaval. So liver cirrhosis causes anastomosis between superior rectal and other rectal veins. So these anastomosing veins results in piles or hemorrhoids, bare area of liver. So central veins and sublobular veins are part of portal circulation. Intercostal veins and phrenic veins end in systemic circulation, you know, right? So these, like some anastomosis between portal vein and systemic veins, hence there is no much significance over here. Okay, so like that we have, so this better you practice this picture and put the table. Okay, and these are the various areas we have, the positions where we have the portocaval anastomosis and which is the tributary of portal vein and systemic vein is given, which I have already discussed in detail. Okay, so this is one more picture which is showing portocaval or portosystemic anastomosis around the umbilicus at the bare area of the liver, lower end of the esophagus, retroperitoneal, that is anterior aspect of kidney, anal canal. Okay, then. So as we have seen, like portal vein receives many branches, including splenic, superior mesenteric, left gastric, right gastric, paraumbilical, and cystic veins. So portal venous blood is one route through which hepatic metastasis, that is the spread of cancer from the GIT, gastrointestinal tract, primary malignancies may spread. That means cancers can spread from one route to the another route. Okay. So in portal hypertension, the veins in these sites become dilated. Hence, they result in life-threatening bleeding, life-threatening hemorrhages. So these are like spaces like varicose veins and esophageal varices can result in hematemesis, that is blood vomiting. In anal canal, these varices can cause hemorrhoids, bleeding piles. Around the umbilicus, they result in caput medusae, which resembles medusa head. So this is a typical case where you are finding caput medusae, dilated paraumbilical veins. Okay, sometimes even thoracoepigastric vein is dilated so much, which we can see. So in order to reduce portal hypertension, the splenic vein is anastomosed to the left renal vein so that the blood can reach inferior vena cava. Okay, in that way we can reduce the pressure which is increasing in the portal vein. Okay, so that is, you can see here how like this is the normal portal vein. Okay, this is superior mesenteric vein, splenic vein. Okay, we know it is draining into portal vein, and in case of portal hypertension, we can do different types of techniques, like where you see like the main trunk of this portal vein is directly anastomosed with the inferior vena cava, or you can see like a part of the portal vein is cut and it is anastomosed with the inferior vena cava, or you can see the splenic vein is allowed to drain into the left renal vein. Okay, so these are like side to side Our end to side are central splenorenal. Okay, and the splenic vein is draining into left renal vein. That is the splenorenal. Okay, so this is how we treat portal hypertension. Thank you.